Kimberly Gonser, and today I'm going to be discussing breast cancer awareness. Think Pink is something that comes up every year in the month of October. It is something that affects women and men of all ages and should be taken seriously. So today I'm going to tell you about the steps to prevent and more about Breast Cancer Awareness Month. Things to watch for breast cancer is if you are tender under the arm area or near the breast. Another thing to watch for is change in the skin texture or appearance. Another thing with that though is that age can come into a factor, or if you had recent weight loss or gain. Another thing to look for is a lump in the breast or on the side of your arm area. And then also discharge from the breast. When you do find these things, you should contact your doctor right away or talk to the nurse and see what the next step should be. It says nationalbreastcancer.org. Ways to check every month is by performing a self-examination. You want to do that at least once a month. They prefer twice, once in the beginning and once in the end. Also for women when you are ovulating. Where you can do it is in the shower or in front of the mirror. You'll want to have your arms straight up and then use 3 fingers and in a circular motion feel for any lumps. Another way you can do it is by lying down. When you are lying down, you also still want to have your arms straight up. Another thing you can use to get checked for is by going for your yearly exam, which is a mammogram and an ultrasound sometimes when the doctor thinks you need it, that you're tough to read on a mammogram. Sometimes men will get mammograms, but not a lot. The only time they will get one is if they contact the doctor and say they've been having problems. It says nationalbreastcancer.org. When you are diagnosed with breast cancer, you will get a biopsy done. It can either be with a needle or surgical. Needle they will just insert and see if any fluid comes out and if it helps with a nodule in that area. Another thing is with the surgical, they'll go in and they'll put a metal piece where they think that the nod was. That way for next time they would know if you did say you found another hard spot. And why they do this is because it could either be a tumor or lymph node instead of breast cancer. This reason they do it is so that they make sure that they can give you the best treatment, says Susan G. Komen site. Treatments that they do is first they study cancer cells. This is why they can determine how quick the cancer will spread, how it will spread, what treatments are the best for you, and if you are healed, if it will come back to you. Tests to determine this is an estrogen and proestrogen receptor test, a human growth factor type 2 test, and a multi-gene test, says cancer.gov. The next step of treatment, if they do determine that you for sure have breast cancer, is they'll go into surgery and remove the cancer. The next step will be chemotherapy, then radiation, and then hormonal therapy. And why they do this is that way, after you go through all of the therapy, your body has different levels, and you will just feel a lot different with your rates of everyday emotions, and they can be a lot more, so they want to get you back on medication that will make you feel good every day. Says breastcancer.org. They also will give you medication in the beginning to help with the cancer to see if it will dissolve. Another reason is because a lot of patients are in pain for the most part of the time, so they want patients to feel at ease when they are in pain. Side effects from these treatments you can get is that it can make you sick, lose your hair, and create weakness in your body. With the losing your hair, a lot of places do locks of love, which donate hair for wigs for cancer patients. But in surgery, if you do have a nod on your breast, they can remove the whole breast, and then later on, once you are healed from all your medication, create a new one for yourself. clinical trials that new patients or existing or pre-existing patients can do is new combinations of existing drugs. This way they can see which drug helps with what and what interacts with another. Another one is bone building drugs to prevent cancer reoccurrence. This way, when your bone gets weak, when you have cancer from the therapy, it will help recreate your bone to get more strong. Also, another study is using higher radiation in shorter period of time, and then compared to low radiation in a longer period of time, says Mayo Clinic. Also, they do blood transfusions to see if certain types of blood is more prone to cancer than others, and if genetics have anything else to do with it. People who have breast cancer, for women, 1 in 8 women will be diagnosed in their lifetime, nationalbreastcancer.org said. Also, many people don't know that men can get breast cancer. For every 100 cases is less than 1 male. So it's very limited, but in a year it equates to 2,190 people, 90 men, sorry. Also 410 who die each year. Another thing is that it is estimated that 220,000 women in the United States will be diagnosed, and more than 40,000 will die a year, says nationalbreastcancer.org. About breast cancer awareness. It is in October and is to do the annual health campaign organized by charities to increase awareness and raise funds for research and to help women and men pay for treatments. A lot of the times after the breast cancer hits, a lot of people don't have the financial aid to deal with these kind of things and pay for their medications. So a lot of the times people will go to banks or charities and ask for them to help raise money so they can get this paid off. Another thing is, when the ribbon was first inspired, was because of the yellow ribbon from military. It was to support them because they were honoring our country. And this is how the pink ribbon came up, because they wanted people to support them in the country. At first it was just a pink visor though, and was turned into a ribbon. The reason for the visor was because they give it to women and men who did the races so they'd be able to see. But they wanted it more nationwide and just not for races. Another thing is, you'll see during the month of October that NFL will dress up in pink gear. The reason for that is to raise awareness and also donate money, because at the end of the month they will auction it off to certain charities for people. But in my conclusion, I want you guys to be more aware of what breast cancer can do to you and what the side effects are from it. Thank you for your time.